Hi, my name is Alexis Lefkowitz. I am doing the pathogen Plesiomonas shigelloides. This is an interesting pathogen because it used to reside in the Vibrionaceae family, but now it resides in the Enterobacteriaceae family. Plesiomonas shigelloides has a quite disgusting mode of transmission. It can be transmitted through the fecal-oral route, through the consumption of infected seafood, especially oysters, contaminated water, contaminated vegetables, and a variety of animals, including cattle, goats, swine, cats, dogs, monkeys, snakes, and toads. Origin and affected regions. Most of the human Plesiomonas shigelloides infections are suspected to be waterborne. It is generally found in a tropical freshwater environment. In addition, the pathogen has been associated with aquariums and fish tanks. There are higher rates of the pathogen in Southeast Asia and Africa, and there are lower numbers from North America and Europe. Some of the reasons for this may include hygiene conditions, dietary habits, regional occupations, or other unknown factors. Mortality rates. Bacterium caused by Plesiomonas shigelloides is a very rare complication. There were 36 cases reported worldwide in 2016. Out of these 36 cases, 16 of the patients died, which means there was a mortality rate of 44%. Morbidity rates. The morbidity rate of Plesiomonas shigelloides is 28%. Here are some other important or interesting facts about P. shigelloides. Usually, it affects people with a compromised immune system. Patients could have conditions such as leukemia, immunosuppression after alleged bone marrow transplant, and HIV. This is why there is such a high mortality rate for this pathogen. A sign is something noticeable to someone other than the patient. The most common signs are diarrhea, vomiting, and fever. The diarrhea is usually watery, and it is not bloody. Symptoms are something that only the patient can feel. The most common symptoms are nausea, abdominal pain, and chills. Diagnosis. P. shigelloides can be diagnosed by using a PCR. These molecular techniques have been developed by amplifying specific DNA sequences of the bacteria. They target genes that code for 23S rRNA or for major virulence factors. Prognosis. The symptoms may appear from 20 to 24 hours after consumption of contaminated food or water. The symptoms could last for 1 to 7 days. To prevent catching Plesiomonas shigelloides, make sure you wash your hands, clean and sanitize diaper changing areas after each use, drink water from a safe water supply, and avoid eating raw shellfish harvested from unknown sources. Treatment. Most of the infections are very mild, so the individuals who are infected do not usually seek medical treatment. If treatment is needed, the infection usually responds well to antibiotics. Plesiomonas shigelloides is not susceptible to ampicillin and other penicillins like piperacillin.